Hello and welcome to this webinar from Candela. Today we're going to be discussing body contouring issues. The first part of the presentation I will be talking about the anatomy and physiology of fat, explaining the different types of fat that you will find within the body, and a little section where I'm going to be discussing cellulite. After my presentation, I'll be handing over to Dr. Beatrice Molina, and she will be discussing the VelaShape system and how she uses that, one, to reduce circumference in her patients, and also how she uses it to treat cellulite. So we'll make a start. And really where we want to start is looking at what the market overview is. Obviously, as you can imagine, during the last 12 months or so, it's been very difficult to get accurate figures. But if we look at some of the numbers from 2015 to 2020, you can see the large increase in the market of basically body contouring, whether that be destruction of fat or where we're looking to reduce the volume of fat. And on the right-hand side of the screen there, you will see the different age groups of patients who are looking for this treatment. And you can see there, obviously, the largest percentage is between the 35 and 50-year-olds. And very, very high percentage of those, nearly 88%, are female, and we only have just over 12% of men that generally are looking for these treatments. So let's move on and look at some of the functions of fat, because obviously fat is something that we need within the bodies. We don't want to have too much of it, but we definitely need a certain amount of fat within our body. So one of the first functions of fat is it provides energy. Clearly, the main energy source within the body is carbohydrates. But when we find that there aren't a great number of carbohydrates, i.e. the energy source available within the body, then the body will start to use fat as a form of energy. Fat also helps the absorption of vitamins, and fat-soluble vitamins require this fat for them actually to be absorbed and then stored within the body. And good examples would be vitamin A, D, E, and also vitamin K. We also store energy within that fat, so it's ready for when we might need it, as in when we have a reduction in the carbohydrates. But conversely, if we consume more food than we need, then that additional energy is stored in the form of fat, and we get an increase in the volume of fat cells within certain areas. It also acts as protection. So it acts as a shock absorber, protecting vital organs and structures. And importantly as well, fat helps to maintain healthy cells. It's part of essential cell membranes, and it also has a function in actually the development of new cells. And thirdly, it's essential that nerve function and normal brain development. So fat has a really important function when it comes to looking at maintaining healthy cells. And lastly, hormone production. It regulates production of sex hormones. And I think one of the easiest ways to actually see this is if you see as patients underweight teenage girls, they quite often experience later puberty than some of their peers would do. So let's move on and look at body fat itself. So here we have some fat cells, and the subcutaneous fat is made of fat cells, and they're all very closely packed together, as you can see from the histology slide in the top left-hand corner. The cells themselves are made of fatty fluids or fatty acids, and these fatty acids are surrounded by a very thin and fragile cell membrane. And this is why it's actually possible to use liposuction to remove these fat cells. Because these membranes are so fragile, when you actually are performing liposuction, you can break these membranes and then actually remove the fluid within each one of these cells. The fat itself, as we all know, is distributed in different parts of the body in different percentages. Generally, the largest areas of fat deposits would be either in the upper trunk, in the thighs, or the lower trunk. And I think when we move on to Dr. Molina's presentation, you will see that these are the areas that generally she is focusing on when she's looking at doing her treatments to either reduce the volume or to improve the appearance of cellulite. And as excess fat is stored in the lipocytes, these start to expand in size, and that's why you see a bigger volume, and that's why, for instance, somebody's circumference increases. It's not that the individual is producing more fat cells, it's just each one of those individual cells is growing in volume. There's a number of different types of fat within the body. Excuse me, we have what we call brown adipose tissue, or brown fat, plus white adipose tissue, which is normally called white fat, subcutaneous, and visceral fat. And I'll go on just to explain a little bit about each one of those different types. So brown fat, as I just mentioned, is also sometimes called brown adipose tissue, and it's responsible for maintaining temperature. It tends to be found in highly vascularized deposits, so particularly between shoulder blades, surrounding our kidneys, in the neck area, subclavicular area, and along the spinal cord. And in essence, this is what people talk about as good fat, because it's providing cellular energy, but it's also, as I mentioned, it's helping to regulate body temperature. And brown fat is especially abundant in newborns. So in newborn children, you will find a much higher percentage of brown fat than you will white fat. And similarly in hibernating animals or mammals, again, because of the fact that it's being used as a regulator of core temperature. So white fat can act as a thermal insulator and help to maintain body temperature, and it's used more so as a store of energy than the brown fat is. So if you look at a healthy non-overweight, so normal weight human, white adipose tissue composes as much as 20% of body weight in men and 25% of body weight in women. And it also has functions with the endocrine system, and it regulates systemic metabolic homeostasis. It's mainly found behind the eyeball, around the kidneys, in the omentum, the mesentery, yellow bone marrow, and the hypodermis of skin. And really the issue is when we start to store fat, it generally is the white fat that we're storing, and our metabolism slows down. So when this happens, we start to gain excess weight, particularly around the hips, the thigh, and the tummy areas. And these, in many cases, I'm sure you'll find with your patients, are the areas they find it's most difficult to actually lose that volume of fat. Subcutaneous fat, as the name would suggest, this is the fat that you will find literally just under the skin. So it's much more superficial than the visceral fat. And it's mainly used to store, this is the storage of fat, which again is being used for energy. It's found all over the body, but particularly the thicker areas of subcutaneous fat you will find on the arms, thighs, and the buttocks. The other kind of fat we're looking at here is visceral fat. Also, sometimes people will refer to this as abdominal fat, and this is the fat that sits around all the internal organs, one acting as a shock absorber, but also giving thermal regulation. And this is basically, from a mechanical point of view, it's very difficult to remove visceral fat, if not impossible. Visceral fat, you can reduce the volume of visceral fat by diet and exercise, but it's not physically possible to remove this by any kind of surgical technique, because this fat is sitting around vital organs, etc. And this is where, I guess, when we're talking about body shaping, we come into this issue of stubborn body fat. So, as I said, the visceral fat generally is affected by diet and exercise. So it's actually possible to dramatically reduce the volume of visceral fat by a calorie-controlled diet and good exercise. But subcutaneous fat can be very resistant to both exercise and also to diet. So in general, when your patients are coming into the clinic and they're looking for an improvement in either circumference, as in reduction of circumference, or they're looking for an improvement in the appearance of their cellulite, it's the subcutaneous fat that we're focusing on and not the visceral fat. And then we run into this dilemma of, what do we do? Do we want to destroy these fat cells, or do we want to reduce its volume? Generally, if we're looking at destroying fat cells, then it's a much more invasive procedure. But if we're looking to reduce its volume, this is non-invasive. It's a quick procedure. It's very comfortable. It has virtually no side effects, and the downtime is minimal. If we take a look at this slide here, you can see the image on the left-hand side, and the visceral fat is shown in orange or red, and the subcutaneous fat is shown in yellow. This individual underwent calorie-controlled diet and took regular exercise, and you can see how that volume of visceral fat has reduced, but the actual volume of subcutaneous fat has almost not altered at all. So this is the real issue that patients come up against. The impact of gaining weight, as I mentioned before, if you consume more calories than the body requires, then that excess energy is stored in the form of fat. And then we will move from being overweight to obese. And the big medical issue, obviously, with obesity is this can lead to type 2 diabetes. And somewhere in the region of 80% of all type 2 diabetics are also obese. And a very worrying number I have here is 35% of American adults are obese, which is approximately 65 million people, which is the total population of the UK. So that kind of puts it into perspective. Obviously, reducing weight can lead to reversal of type 2 diabetes, which is probably one of the biggest advantages of losing that excess weight. And as I've already mentioned, it has much more of an impact on our visceral fat than it does on our subcutaneous fat. And when Dr. Molina moves into her presentation, again, she will be going through how she's treating that subcutaneous layer as opposed to the visceral layer. So finally, I just wanted to talk a little bit about the physiology of cellulite. Those of you who have cellulite, I'm sure you will agree it's not something that's very pleasant. You see it on the skin surface, and it's resulting from a herniation of some of these fat cells, generally through a weakened dermis, and you see this dimpling, and it affects between 85 and 98% of all females. And if I go to the next slide, I think it shows it in a little bit more detail. So in essence, what can happen is, if the fat cells start to increase in volume, then we get a larger amount of pressure building up between those fibrous septi, so in effect within these pockets within the subcutaneous fat. as the volume starts to increase, because the septi are not particularly mobile, you will get two things happening. One, you get a bulging effect on the surface of the skin, but you will also get pressure pushing down into the muscle layer and certainly affecting drainage and also some of the blood supply within that. So you're compressing the lymphatic drainage system and blood vessels, and by doing that, this then starts to increase the amount of fluid, intracellular fluid in these areas, and this then increases the volume and it increases the pressure, and the whole thing becomes very much a vicious cycle. You very, very rarely will see a man with cellulite, and it's down to the way that the fibrous septi are arranged within male fat as opposed to within female subcutaneous fat. So you can see on the left-hand side, those fibrous septi in males tend to be in a much more crisscross fashion. So therefore you don't get that same build-up of pressure which shows as the dimpling on the surface of the skin. Many things can lead to the formation of cellulite. Poor circulation. So obviously if the circulation is poor, if the lymphatic drainage system isn't working correctly, you'll get an increase in that intracellular fluid, which starts to build up the pressure within these pockets held very firmly either side by the fibrous septi. Hormonal influences can make a difference. It can be hereditary, it can be lifestyle, it can be diet, lack of exercise, or obesity. But it isn't always the case that if somebody has cellulite, that they're overweight. Number of different classifications. So grade 0, there's no dimpling when pressure is applied. Grade 1, you will only see that dimpling if you pinch the skin. Grade 2, dimpling is again here, it's only visible when your patient is standing, but when they lie down, then you don't really see too much of that dimpling. And then grade 3, here, this is the much more severe form, and we have dimpling both standing and lying. And again, this is, I'm sure, something that Dr. Molina will be going through in her presentation. But really, when you're looking at your patients, you want to consider what type of cellulite they have. Is it very soft, which means that it's much easier to treat it? Or is it much harder? And therefore, because it is much harder and it's a much tougher tissue, this becomes more of a challenge to actually improve the appearance in this harder cellulite tissue. So that's a brief run through on some of the ANP of fat and talking about cellulite. So what I'm going to do now is I will hand over to Dr. Molina, and she's going to be discussing using the VelaShape 3 for reducing volume and also treating cellulite. So Dr. Molina.
Thank you, Hamish. That's very informative and definitely complements very well what we are going to do next. So really, we want to focus a little bit more on the clinical side when patients come to see us, what they really are looking for, and obviously what ways we can help them. So if we looked obviously at the VelaShape technology, we know that it's been around for many years. Obviously now we know that we got a more sophisticated and a very nice looking new machine. And it's got a CE approved, of course, for the non-invasive treatment of cellulite and body contouring. It's very useful as well after post-liposuction. As we all know, a lot of patients will have a surgical removal for the fat, at the end having still quite an uneven surface. So actually we do see that, and VelaShape is very useful. And of course, after having a baby, as we know, the abdomen gets very lax, and it's very good way. And we will see a photo in a minute of a lady who had great results after the delivery of the child. So the mechanism of action for the VelaShape 3 is going to combine three main things, which is what it makes this very unique. It's a bipolar radiofrequency, of course, and through this we're going to be able to hit the tissue superficially to go to 2 to 3 centimeters, sorry. And of course, we also have got an infrared heating as well, which is going to complement the bipolar radiofrequency. And of course, the very important part for me is it's got this large head, which uses a vacuum through a pulse, which is going not to only obviously help the blood supply and the movement of the tissue, but also is going to improve to the delivery of this heating of the bipolar, because the penetration is going to grab the tissue when it's moving, and it's going to make it more effective. So as we've seen already with this mechanism of action for the VelaShape, we can achieve what we said, both body contouring and improvement of cellulite. So what's happening with the radiofrequency is going to be hitting these deposits of fat under the skin. And as Dr. Hamish said, it will have to be that subcutaneous fat. So it's the fat we can pinch with our fingers. You can grab it and you can feel it. And to be honest, when you go a proper cellulite, you can feel the little balls inflame on the skin. And of course, through these as well, we're going to create an improvement of the septi, which is, as we've seen on Dr. Hamish's slide on females, is unfortunately very fixed in vertical, so it will allow to improve that. And of course, we are going to create, because of the heat, because we can reach maybe 42, 43 degrees easily, quite comfort, we're going to improve some collagen. So we're going to have some skin tightening, some fibroblast activity, and of course, some remodeling of the extracellular matrix. So the whole combination is going to really improve the laxity of the skin and an overall improvement on the structure and the texture of this skin, apart from, of course, shrinking a little bit the volume because we are working on the fat cells. So what really the bipolar radiofrequency, as we said, is doing is that direct hitting on the adipocytes, but of course, that collagenesis and stimulation of fibroblasts, plus the improvement on the blood supply. So we're getting a vasodilatation, and we're going to improve the circulation in the area. And as we can see here on this image, of course, with the mechanism of action of the adipocytes will improve. And as we heard before, again from Dr. Hamish, the adipocyte tissue is obviously very important on regulating the whole body energy, and of course the glucose homeostasis through this double function of organ and systemic levels. So of course, in one hand, the adipocyte tissue is going to store energy in the form of lipids, and it's going to obviously control the mobilization and the distribution in the body. And unfortunately, we're born with a number of fat cells, as we know, and they don't all necessarily are going to, well, sometimes if you overeat, they will, but sometimes you get only a percentage of them enlarging. And on the other hand, of course, the adipose tissue is going to act as a proper organ. So it's an endocrine organ which is going to produce all these bioactive factors, and of course, is going to be very important on the metabolic pathways. So we need to be sure, obviously, that we are sensible in the way we approach these. Of course, with the thermal effect of and improving this metabolic action, we are doing it through both, obviously, the direct heating and the improvement of oxygen and the blood supply, and of course, by the shrinkage of the adipocyte cells, improvement of the fibroreceptors, and of course, the collagen production. And obviously, the vacuum, as I said earlier, is very unique for this device. It's amazing because it targets that radio frequency to the area, so you can focus specifically on those places you can really work with. And of course, is going to improve, as we said, not just circulation, but also the improvement of the lymphatic drainage, and it's going to help clearing all that excess, toxicity, which is obviously lying around in the skin. So let's have a look at what we see most commonly in clinic. Firstly, we need to be sure we select our patients correctly. If we don't tell them if it's going to work or not, they will be disappointed. We really need to do that assessment. And if we, as we have seen earlier, if you got someone with their body mass index is obviously too high, but do measure the circumference of the waist as well. We need to make sure there is no intra-abdominal fat only, because in that case, it's not going to work. And that's the typical abdomen. You will see someone is slim and they got a very, very large abdomen. And when you press extremely hard, you cannot really pinch any of the fat, and you can really see that it's an intra-abdominal. Of course, when we get people with the are a little bit more obese, the fat can be even in the joints and in the muscles. Of course, we cannot treat that either with this device. As I said, we have to be treating typically people that obviously they will have a little bit of excess, but not overly the top. I'm going to now try to play the first video to see how we treat the abdomen. And I'm going just to put it on silent for a second, just because it's a little bit noisy so you can hear it. A little bit as well as with noise. I just move it around the abdomen. I think I managed to pause it, and I think I have managed to get the volume back to normal. So this is the abdomen I was talking about. This lady had the baby, and of course, apart from the stretch marks, it was mainly the laxity of the skin, and she had a great result in just 3 sessions. So we can see the volume of the abdomen has shrunk, but also the skin quality is improved dramatically. So this is a very typical result from VelaShape. I just wanted to really point out that all these things we're talking about today, they are backed up by science, and there is clinical proven results in multi-centers clinical studies, and there is a lot of them that have been publicized to obviously really prove that at least you get 2 centimeters reduction in an abdomen. And the patients, I can say, they're always very comfortable and they tolerate it very well. I personally love the treatment, particularly on the legs, because it feels you're having like a really good deep massage. This is another sample of just improving skin quality. So this is just for the tightening, not so much of the fat, is very little fat in here. And just remember that the machine has also got a smaller head, which we will see in a minute, but also some of the flat heads you can use to just apply the heat and improve, obviously, the skin quality, but without having to suction if you got areas where it's difficult to do so. And this is, again, another one, and this is one of my staff who try the VelaShape, and again, really good results on 3 sessions, just for the abdomen. And here we're going to see again the video, which is going to show us the treatment for the area. With a lot of women, we find, when you put your bra at the back, or you want to wear a nice dress, and it's a little bit of a stick in there. So let's try again to see if I can get the video work. Well, I couldn't get it work. Oh, now it's working. There we are. So we're just marking the area, and then, to be honest, it's the same than before, but you can see the area we're treating. And this is a typical example on this before and after photo. So this is 4 weeks after 5 sessions on, well, love handles. You can see again, that's the area on the video. Not sure why the second video is not playing. No idea. And then this is from the back, the same lady, and that's the area we marked as for the treatment. And as you can see, that's actually a very, very good result again. So now let's move to another little area where people don't like to have the fat, and it's a little bit lower. This is the proper love handle, so up the size of the abdomen. We treat this as a separate type of treatment. And in here, hopefully, you can see again how to do it. Maybe not. I think the videos don't like me today. So let's have a look at the results. Go. Oh, now it's there. So you have to be slow. When you do it, but not too slow, because then it gets hot. Okay, so I think that was obviously moving into the legs already, which is this one. I'm not going to play again because otherwise, so you can treat the leg on different, normally we do 3 areas. So the front of the thigh, the sort of inner thigh, and then the back of the thigh. But of course, sometimes people will need to concentrate on one place or another. And I do like treating the knees separate, as I will see as well in a minute. So this is probably the most requested treatment we get this time of the year. Maybe this time of the year be less because of COVID and people are not going on holidays, but usually during spring and summer, everyone wants to have the perfect legs. So you tend to do 3 to 5 sessions depending on how severe, obviously, the cellulite is. But if it's just for a skin tightening, obviously after 3 sessions is great. But the advantage I find as well, then even if you have one quick treatment before you go on holiday, you do get some nice results on the skin quality as well. So actually each treatment will work, but of course it's better to have a set of them. And this is a lady who just wanted a little bit of improvement. It's much harder to see on this picture because obviously apart from a small reduction on the circumference, it's really the skin quality, which is much harder to appreciate, but it's great results. And this is what we're talking earlier with treating the knees, where you really want to obviously concentrate in a very small area. I prefer to use the very small head. And just remember as well that with the machine, and that's why I put a little photo here, is obviously an intelligent feedback. So the machine is going to always be telling you the temperature is happening at the moment in the body, in the skin, and of course it's going to monitor the time as well you're working on this area. So it has got some protocols built in the machine where you can actually just follow them and it will tell you exactly what to do. But sometimes when you've been very experienced with these treatments, you like to just play yourself with the timings or actually the temperatures or the suctions, and then just get your own protocol in place. So now we hopefully get, yes, a nice before and after. It's definitely something with the videos and me doesn't like it. So this is a before and after for improvement on the skin quality on the above the knee with a small head. Before that, she did have the upper part of the leg done as well. So it's actually a combination of both. But yes, we can see here it's very, very good. One which is great, maybe a little bit less popular because people don't even think it can happen. I mean, let's hope this one works with the video, but it's treating the bum to give you the perfect bum lift for a bikini. And see if it works. Okay. Yes, it's working. Perfect. So the idea is to go from the upper part of preview thigh, so where you obviously just the really upper part all the way up by pushing the bum and then going all the way up as much as you can. And I spend usually about 12 minutes, 10 to 12 minutes per area. I think in total will be 15 because it could take 2 to 3 minutes to maybe hit the skin a little bit. And I like to keep that heat for at least that 10 to 12 minutes. And the results are very, very good. So let's pause that one. As you can see here, that's one. So it's just not only reducing the volume, but also you get obviously a very good lift. That's another one on a younger girl. Again, really good results. And on the side, we can see the elevation and the angle is totally changed. And this is just even after the first treatment. This is straight after, as that's what I mentioned earlier. You actually get a nice feel for the skin. So if you wanted to wear a dress, you could, say you were doing your knees and you want to wear a dress that evening, you will see a difference on the day. And this is great because this is after 4 sessions and we can see how good the lifting is being in here. But also the skin quality is pretty good. And another one we forget is obviously the arms. And it's a little bit more difficult to treat and you have to really be selective because obviously the little bit of the pinching with this, we tend to use the small head. Sometimes you can use the flat heads, but you need to be very experienced when you get to that because obviously the heat will get quite quickly because the area is a lot smaller. And on this one, hopefully we can see again the video. No, doesn't want to play. Yes, it does. Okay. So yeah, go all the way from the flexion of the arm, all the way up as much as you can. And start with one arm, place an arm in the area where you get the last and you can feel the little fat there. And the balls there when you twist it. Perfect. And you can see here the results for the quality of the skin and also that little bumpiness and you can see that's improved. I mean, personally, for some of you, if you do injectables as well, what you got left in there will be maybe a really good thing to do, maybe with something like a Profilo in a Ryo remodelator. Some people like to use threads afterwards or something like that to finish that little bit of the skin. Another thing you can combine very well with VelaShape on this area is a PRXT33. That's like a TCA in combination with hydroxy peroxide on low molecular weight. So it doesn't really act as an acid because it's been sort of neutralized when the way they penetrate. So it's a fantastic way to combine. Another one where you could combine your VelaShape with a PRXT would be when you got the stretch marks, or you can use, of course, the machine from Syneron Candela, which is the E2, and you got the sublative radiofrequency. That's fantastic because you can treat the superficial skin and create a bit of sublation and tightening, and combining it with the VelaShape, you get very good results on the stretch marks or improvement of the skin quality where you got that sort of a little bit more aged skin. So really, in summary, I will say that for me, is the best machine in the market. We have moved from the Vela 1 to now the 3 over the years, and it gives great results. It's comfortable. You need a lower amount of treatments if we compare it with the older modalities of radiofrequency. We used to have on the old days a machine, and we used to have to do at least 10 or 12 treatments to get even a comparison to this. And so, yeah, it's quick, it's comfortable, it works. Is easy to use, yeah, it gives you fantastic results. So get ready for your body for this summer. So thank you very much for your attention, and I hope you enjoyed it.